Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today I have Dr. Attaya Suvannasankha from Indiana University School of Medicine. She's Associate Professor of Medicine and leads the effort in myeloma at the institution. And I am glad to have her here today. She's really brought up the program there to new levels. And welcome, Attaya.
Thank you so much for having me today, particularly on the topic that is so important, but also very debatable still in our current myeloma world. So I'm
Yeah.
hoping that we'll have very lively conversation.
Yeah, so how I use MRD in the management of myeloma, and I would say that if I interview 10 people, they're going to have a different take on it. So that's what the good thing about this is, that there seems to be no, right now at least, set pattern and a right answer perhaps. But just to start off with, just to educate those who are uninitiated, how do you check for MRD in multiple myeloma?
So that is the first kind of topic that if you talk to 10 people, they're all probably passionate about different technologies that are being used. But ultimately, I think it's really because we are so much better with how we treat patients, so that rather than just sort of checking the blood for M protein or the light chain, we have gone way beyond that to be able to go even deeper to say, well, if the cancer cells are hiding out, we don't see them, and they're no longer making enough of abnormal protein that we can easily test in the blood, could we then evaluate inside the bone marrow and ask a question? If we look extremely hard, how many of the residual cancer cells are still available? So there are two main technologies, and I'll tell you what I use more. Two main technologies that have been around the longest. One is a flow cytometry assay, which is evaluating the remaining cancer cells based on the proteins that they uniquely expressed. We are already doing classic flow cytometry to identify these cancer cells. This is really a technique to go analyze more number of cells. Usually flow cytometry would capture 10,000 cells. In this case, we're going to look up to 10 million cells. And as you're showing in the diagram here, we're really trying to understand if we look under the surface of the water, and where that cutoff is where all of the blood tests start to normalize. Are we seeing just an ice cube or still a big iceberg underneath? So flow cytometry is sort of already available at a lot of institutions. Being able to set up these extra colors to look more definitively for the cancer cells has actually been kind of gradually getting adopted at academic centers all around the country.